All right, and you're back to another episode of PT Meal Physical Therapy Podcast, your weekly serving of insights, information, and inspiration from the experience and expertise of Filipino physical therapists. I am Johan de la Paz, your host. Let's go on with the show. So today, I have as guest Michael Datu, a physical therapy PT supervisor in an orthopedic geriatric skilled nursing facility. He is a certified strength and conditioning specialist. He is also an American Physical Therapist Association certified clinical instructor and a proud Angelean. So, in this episode, we are going to talk about physical therapy in a skilled nursing facility, what it looks like, its in and outs, and how different it is in or from other settings. So, Michael, welcome to the show.
Thank you, Johan. I am very excited to be here. I'm very humbled as well. Thank you for sending an invitation to be our guest speaker. I am very humbled to be here. Thank you.
I'm glad that you're here, and thanks. Let's thank RV for introducing us, and I'm excited for our conversation. We have a tiny conversation before our recording, and that is already inspiring. So, but before we dive into our topic and our conversation, could you give us a little background on how you started as a physical therapist and what's your role now?
Absolutely. So when I went into college in the university, I went to the Philippines. Very proud to have graduated from there. Prior to that, I did all of my schooling in California. That's why I like to say I'm a proud Angelean because I'm from Los Angeles, but I'm also from Angeles City, Pampanga. And I feel like I
Nice.
have the best of both worlds.
Mhm.
I really believe that. I had aspirations to go into medicine at that time, and I asked them what was the hardest pre-med, and they said PT was the hardest pre-med. I don't know how others feel about that, but I thought PT was very hard. Um, they said because the anatomy, physio, we do a lot of differential diagnosis. It kind of very well fits into med. And my uncle is also a physical therapist, and my aunt, his wife, so that definitely helped out as well. Um, During my stay at Angeles City, I think I've had the best teachers. And in preparation to this, the only thing I wrote were actually their names because I just wanted to be very free flowing with this, just very honest. But I had some of the best teachers. If I may, I'd like to say their names
Yeah.
because I wanted to give back. So my professors, Pia Basilio, Glenn Asuncion, Alleluia Reyes, Dominic Adolfo, Marvi Velasquez, Dr. Carmelo Cunan, Dr. Arnel Morte, and Dr. Arvi Vitente.
Mhm.
All of these instructors and professors have been extremely inspiring, and I definitely wouldn't be where I am in terms of my knowledge and my position without them. They definitely picked me up when I was low, but every time they kept pushing me forward, and I really love these teachers. Dr. R.V. Vitente specifically has been my mentor ever since I kind of graduated. So Dr. Vitente, okay, so a lot of PTs know him now as a clinical professor, a geriatric certified specialist by APTA, a dementia expert. He has so many credentials, as you know. His name is extremely long, but when I first met Dr. Vitente, he actually was the instructor to one of my classes, and from even at the start, man, this guy could teach amazing things.
Mhm.
Um, he definitely needs to be on your show, Johan. He definitely needs to be on your show. And one thing about him too that's really unique, he could sing. So I don't know if he could do a sample on your podcast too.
Yeah, he's
But
been a guest, and I've met him once when in a CSM, and we along with other Filipino physical therapists, and we did karaoke. He
mhm.
sing good.
Yeah. I think right now too, he is some part of a geriatric. He's like the geriatric, some part of a geriatric department of the APTA,
Hmm. Yes.
which is amazing. I mean, Dr. Vitente is definitely leading a lot of physical therapy practices. And again, I just wanted to say that about my teachers, whom I really love. After that, at Pampanga, I had some of the craziest. I feel like we had some of the hardest schooling in the Philippines. It's so different. Identification here in America, it's multiple choice, as you know, kind of
Mm-hmm.
perhaps maybe fill in the blank, things like that. But in the Philippines, it is difficult. It's either you know it or you don't. And when we ask the teachers, like, what's the topic on? They always say anything under the sun, you know? So it means everything. It could have been a month ago or 3 years ago. So that's really inspiring. As soon as I graduated from Angeles University Foundation, I went back home. Well, home here, I have two homes. I feel like Philippines is also my home. I went back home here to Los Angeles, and I I did my ninth month rotation at an orthopedic geriatric SNF at Burbank,
Mm-hmm.
in which I was the a student directly to the director of rehab for 9 months.
Okay.
And I think that is such an amazing opportunity. Joe Chacalaco has definitely mentored me. If you see my story, um, Johan, it's all about my mentors. It's
Mm-hmm.
all about my mentors. And that's something that I'll lead on kind of towards the end. But Joe has always helped me. He's always been a big brother to me, guiding me and definitely teaching me so much about physical therapy, the
Mm-hmm.
practice, as well as administration too, because they don't teach how to be, because he's the director of rehab. At times he'll definitely guide me to some administrative roles that I'm able to do. And then also another great thing, Johan, is my third mentor. I mainly have three. Is the director of nursing. Her name is
Mm-hmm.
Shirley Friedman. She definitely teaches me a lot about leadership.
Mm-hmm.
I think the building would uh, I don't think our building currently would run without the director of rehab, Joe, director of nursing, Shirley, as well as the administrator, which her name is Alex. She's amazing as well. But um, those are my three mentors for sure. And then I got my CSCS, my Certified Strength and Conditioning Specialist. Um, and then currently right now, because of Dr. Vitente, I got inspired by him. I'm actually scheduled to take the geriatric certified specialization next year in February. And after that, the orthopedic one.
Nice.
So hopefully if all things goes through, I'm triple specialized.
Right,
So
right.
I'm excited. Yeah.
Mm-hmm. Exciting.
And
So,
that's where I am now.
mhm. So, you've mentioned a lot about like mentors and how they shaped and mold your practice. So, what are the things that um, you see in your mentors collectively that what inspired you or what you want to take in and absorb and carry with you in your practice.
Mm. I think humbly, Johan, I think that's one thing that I'm really great at.
Mm-hmm.
I like to, if you know Pokemon, I'm
Mm-hmm.
kind of like the mime. So I try to emulate and duplicate the
Mm-hmm.
things that I like about each mentor.
Uh-huh.
So I definitely observe.
Mm-hmm.
I want where Dr. Vicente is. I think that's where I want to be positionally, as well as educationally. Um, he teaches in the university.
Mm-hmm.
I might not want to, but I want to have his knowledge.
Mm-hmm.
With Joe, my director of rehab, our he's the glue to our rehab team. And one thing that's unique about SNF, it's very team based.
Mm-hmm. Sure.
We talk, and I could definitely go over that later, but we talk to nurses, we talk to respiratory therapists,
Mm-hmm.
occupational speech. We also talk to doctors. And then a super unique thing about our SNF is
Mm-hmm.
it's actually one of the biggest. So I think it's about 188 bed capacity.
Oh wow,
Yeah,
that's a lot.
and the total rehab team is about 24. And there's like about, yeah, it's huge. It's like 23 therapists. So we're all constantly speaking to each other. We're all constantly communicating to the betterment of the patient. But and further, so that's what I would incorporate Joe.
Mm-hmm.
Joe has a certain maturity that I'd like to duplicate a certain um, he's very good at accepting, he's very good at leadership as well. Shirley too, I'd like to emulate her leadership,
Mm-hmm.
as well as her loyalty, her she really cares for patients. All three of these mentors do. They all care about patients and they want to do what's best.
Right.
But again, I just pick and choose, and I try to emulate it as best as I
Mm-hmm.
can.
Right. It's hard to be a director of rehab in a skilled nursing facility because I mean, when I worked there, I was looking at our DOR and he has a lot of admin stuff, patient stuff, and of course the family relative side as well to interact with them. Like we need a lot of patience and of course uh, leadership, as you mentioned. It's hard. I won't be able to do that. But yeah, I
Yeah.
look up to the DORs, especially like so. We're talking about skilled nursing facility. Let's dive into the topic. So before other things, how would you describe a skilled nursing facility? What is a skilled nursing facility for those who are not familiar on what it is?
Okay. The best way to differentiate it is
Mm-hmm.
to see the difference between a skilled nursing facility as well as a nursing facility.
Mm-hmm.
So at a nursing facility, it's mainly nurses and the patients,
Mm-hmm.
whereas skilled nursing facility, it's more of a rehab institution or facility,
Mm-hmm.
and um, there's rehab in it.
Mm-hmm.
That's why it's skilled. If there is no rehab in it, it wouldn't be considered a skilled nursing facility.
Mm-hmm.
So the main thing is in a skilled nursing facilities, things will not happen if nursing's not there. Things will not happen if rehab's not there.
Mm-hmm.
Things will not happen if respiratory therapists aren't there.
Mm-hmm.
It's a combined factor of all of these disciplines as well as departments. Activities personnel have a huge portion because they if a patient we send patients to them if they're at high risk for falls.
Mm-hmm.
So again, this is us. If you are a team-based person and you kind of like more acute things or more subacute
Mm-hmm.
factors of physical therapy, SNF is definitely the place for you.
Mm-hmm. These the patients that you have are patients coming from the hospital, right?
That is absolutely correct.
Mm-hmm.
Yes, when they're more stable.
Mm-hmm. Okay. So, can you describe to us like what a typical day of a physical therapist is in a skilled nursing facility?
Okay, what I love about skilled nursing facility is that you just kind of clock in your 8 hours.
Uh-huh.
So I could come in as early as about 7,
Mm-hmm.
and then I could come in as late as maybe 11 or lunchtime if I wanted to.
Oh, okay.
Yeah. Yeah. So I
That's
clock in
nice.
8 hours. Yeah. So
Uh-huh.
it's very flexible. So as soon as I go in, I put obviously my stuff down. I look at my schedule, I print it out. I see who is scheduled for treatment and the co-treatments. I check who the OTs are because again, skilled nursing facility is based on teams.
Mm-hmm.
Um, I I, as well as the OT, need each other's discipline in
Mm-hmm.
order to perhaps sit a patient or do something functional. Where if we separated, perhaps the only thing we could have done might have been range of motion,
Mm-hmm.
which isn't the best for the patient.
Right.
And then after that, I would definitely talk to um, uh, each. So our total team is about 24, 22, and then we have sub teams.
Mm-hmm.
So I love the team that I'm part of.
Mm-hmm.
Luis and Taylor are amazing PTAs. I requested them for that very reason because they're amazing. And then we always have the best communication. We talk about a patient, and the thing I love about SNFs is that these are patients that again might have fractures or orthopedic conditions where maybe the hospital didn't catch,
Mm-hmm.
or perhaps on the way to subacute, something might have happened.
Mm-hmm.
And that's where I think the knowledge of PT comes into play. I think, again, there have been instances where we go in, we suspect a dislocation of the shoulder, maybe anterior dislocation,
Mhm.
and then we request an x-ray. And once it's done, perhaps it does show that anterior dislocation. So that's one thing I love about PT. And a lot of times in our facility, a lot of times PTs will be called into, hey, can you check this patient to see if you suspect that they have any broken bone? So maybe we could refer to ortho,
Mhm.
refer to maybe a radiologic procedure or anything like that. And
Mhm.
then the main day, again, is just treating the patients, going back and doing daily documentation. Each treatment there is definitely much more than your outpatient.
Mhm.
Um, maybe I usually see maybe about 6 to 8 patients a day,
Mhm.
and each patient might be about 45 to an hour.
Mhm.
And then the remainder of the time, I'm working with nursing, I'm working with maybe activities personnel, um, I'm talking to family members. It's definitely a holistic approach,
Right.
overall care.
I like when you said that you were able to catch things that other the other medical professionals didn't observe, and I think that's very important for us as physical therapists to be able to notice since we're the ones regularly seeing them. Uh, did anything change with how you uh, see patients in terms of probably like management or time when the change when PDPM came?
So once PDPM arrived,
Uh huh.
actually COVID hit, right?
Right.
Yeah. So I think it was PDPM and then 2 months
Yeah.
and then COVID,
COVID. Yes.
something like that.
September would be the September October PDPM, then COVID around December January.
Yeah. So
Mm-hmm.
one thing with PDPM that has changed a little bit is some of our treatments times have changed.
Mm-hmm.
Perhaps a patient was an hour and a half, might, and their insurance currently is approving maybe an hour of treatment. So a
Mm-hmm.
little bit less, but not extremely drastic.
Mm-hmm.
So far, those are the only changes we've seen.
Oh, okay.
And yeah, so since PDPM is patient driven,
Mm-hmm.
we just hope for the best with it.
Right.
I think we would have had more information if COVID didn't hit, but because of COVID, we couldn't plan. We
Mm-hmm.
had a COVID unit treating patients. So I was in the COVID unit, I think like three, four
Wow.
times. Yeah,
Wow.
3 to 4 times. And as you know, SNFs were the worst hit by COVID.
Mm-hmm.
So that's something that, I think I'll always take in is the therapist that I came with during COVID. The whole team actually,
Mm-hmm.
um, we're very brave to face COVID because remember, this was a time when especially in the beginning, it didn't look good for a lot of people, right?
Right. And we didn't know what's happening or what's gonna happen in terms of our practice and the admissions.
Oh, absolutely. Everything went down.
Mm-hmm.
People of all ages were being affected,
Mm-hmm.
so it was very difficult.
Mm-hmm. So you were talking about working in the SNF is more team based. So aside from like co-treatment, what other things would you say is team driven in a SNF practice?
Okay, so what we would do at times, I have great examples. Let's say we are having a orthopedic knee replacement, right?
Mm-hmm.
Lower extremity, sitting at edge of bed. Hey, ma'am, do you want to drink some water?
Mm-hmm.
And then once they drink water, we notice that they start to choke on it,
Oh,
right? And
okay.
then what we would do at that time is if we notice that it's consistent, we
Mm-hmm.
would stop the fluids,
Mm-hmm.
and then we would actually call and refer back to speech therapy.
Mm-hmm.
And I think that's an amazing thing that everything is close.
Mm-hmm.
Everything is kind of in more or less in one facility in terms of departments,
Mm-hmm.
where you grab the phone, hey, um, speech therapist, can you please, whenever you have time, can you see this patient? This patient's
Mm-hmm.
choking on thin liquids.
Mm-hmm.
They would be the experts.
Mm-hmm.
So that's one thing I love about skilled nursing facilities, at least with my experience,
Mm-hmm.
is we will all refer
Mm-hmm.
to the expert of that field.
Mm-hmm.
Anything kind of more so physical, broken bones, it'll
Mm-hmm.
definitely be PT. Anything more on, again, ADL management,
Mm-hmm.
perhaps patient needs a commode.
Mm-hmm.
Let's talk to the OTs because they know best.
Mm-hmm.
And again, choking, any hazards, any problems with speech or pronunciation or anything like that. Well, we have a speech therapy on board, so we could go to them. And obviously, nursing for wounds, um, for a lot of other medical difficulties.
Mm-hmm. In your practice, because some therapists would have this notion that, I mean, in any practice, here in the US, they would say, "Oh, physical therapist, legs, waist down, legs, physical therapist, occupational therapist, waist up to the neck, hands, OT, neck up, speech." So,
Yeah,
how's your practice in your facility?
it's similar. It's
Similar.
similar,
Mm-hmm.
similar. And the reason why we split it up that way is based on documentation.
Mm-hmm. Mm-hmm.
Uh, be, because if obviously OT is skilled and taught the entire body, same with PT.
Mm-hmm.
We just have different focuses
Mm-hmm.
and different um, lines of expertise. But once we're joined again, it's that holistic approach.
Mm-hmm.
But it is that. So if if there is a problem with the upper extremity that I know because
Mm-hmm.
I'm a PT,
Mm-hmm.
I would definitely speak to the OT in
Mm-hmm.
charge, and we would communicate,
Mm-hmm.
and we would talk about it, and then we would reach a conclusion. So it's not, at least in our facility, it's definitely we're at a point where every every decision, as well as um, things to be put under consideration, are very acknowledged and respected.
Right. Nice.
Um, if if I think there's something going on with the right upper extremity, and maybe the OT doesn't, we'll
Mm-hmm.
talk about it. Or maybe if the OT thinks there's a problem with the hip and I don't,
Mm-hmm.
we'll talk about it.
Mm-hmm.
And then we'll figure out a consensus there, and we'll do what's best for the patient, obviously.
Mm-hmm. And that also like depends on what the patients wants and goals. Mm-hmm.
Yeah.
Right.
Yeah. And
Nice.
their prior level of function. It's all about their prior level of function.
Mm-hmm. Right. We've you've touched on what you love about working in a skilled nursing facility. You started with that one thing is that you refer to, to experts, whatever you find out about the patient. So what else do you love about working in a sniff?
One thing that I love, Johan, is again, I love the I, again, the communication, the
Mm-hmm.
team base,
Mm-hmm.
and I guess the respect. Again, everything is just kind of what I've acknowledged to.
Mm-hmm. Right.
I definitely love that. And one thing that so what I've always wanted growing up is I wanted to be in a profession, a medical profession,
Mm-hmm.
where I wanted to study so hard, where just mentally in my head, I'm going to study so hard where this patient will only get better with like my knowledge. That's what I think,
Mm-hmm.
right? So I think that is kind of a very good understanding when you're in school. Hey, even though it's not true, hey, I'm I'm very good in my craft to where this patient will only be better with my treatments, but I have to continue. What if they have a diagnosis that I'm not too familiar with? I have to keep pushing. I have to keep continuing. And the important thing too is with that mindset, you have to be humble.
Mm-hmm.
Of course, you have to be very humble.
So communication, being humble, respect among peers, and referring to other experts. What are the challenges now that you have encountered in your practice? You said you've been in the skilled nursing facilities for 4 years already. You've worked there for four
Mm-hmm.
years. So, what are the
Mm-hmm.
challenges that you've encountered um, working in a team, working in a sniff, probably problematic cases or patients?
Well, one definitely is PDPM, right? And the
Mm-hmm.
reason why I say that because I don't know what's going to happen just yet. Okay.
Right.
So far, the main thing that has occurred is just some patients have decreased on time.
Mm-hmm.
That's the main thing.
Mm-hmm.
What else? Problems? To be honest, Johan, I love where I work.
Mm-hmm.
I'm trying to think of issues right now.
Mm-hmm.
Um, I think one thing too is perhaps sometimes because of insurance,
Uh-huh.
perhaps
I
the
agree.
patients at times go home earlier than what is expected, or they go home earlier, um, maybe despite a recommendation of yours that you would like to continue for maybe a week,
Mm-hmm.
professionally. But again, that's in all settings,
Mm-hmm.
right? That's in all settings because we have to deal with insurance.
Right.
But that's definitely mainly it, Johan.
Mm-hmm.
I would say that, yeah, because the place where I work with is great. Perhaps another thing,
Mm-hmm.
another downfall
Mm-hmm.
is because you work are working with so many people, for sure, you won't get along with everybody, right? But that's okay.
Uh-huh.
You really don't need to get along with everybody. It's preferable.
Mm-hmm.
But the main thing is you're professional in what you do and you do your job, which
Mm-hmm.
is you try to make the patients better. That's the
Mm-hmm.
number one thing. That's what it ends up with.
Right.
But again, our building has more than I think 300 employees, I think. So
Wow.
of
It's
course there
huge.
might be a time when, yeah, it's huge. And two floors, two different units. And it, of course there might be maybe a CNA or a charge nurse or even an OT or a
Mm-hmm.
PT that you don't get along with, but just because of the constant communication that you are required to have for the
Mm-hmm.
benefit of the patient, you are required to communicate with them because if you don't, that patient will be negatively affected.
Right. I understand that. Yeah. I wanted to ask about where um where do you treat your patients now? Do you bring them to the down to the facility, or do you treat them in their rooms? Because when
Okay, so
COVID came, we no gathering was supposed to happen. So when COVID came, we have to treat them in their rooms or the hallway or something. So right now at this point, do you bring them now to the rehab clinic or area?
the patients that are in consider the green zone,
Uh huh.
which are which our building follow is very strict.
Uh huh.
We follow CDC guidelines as well as the Department of Health guidelines as well. So we have a green unit, yellow unit,
Oh wow.
and yeah. So if it's a yellow unit,
Mm-hmm.
the patients do not leave the yellow zone.
Okay.
If it is the green unit, we could actually bring them downstairs. And our gym is quite large. Our gym is I don't know how to explain it, but it's one of the biggest for sure for a SNF. Sometimes in SNFs you treat in hallways or you treat in a very small room. Our gym is very large. It's very large.
Mm-hmm.
Um,
So you can do
yes, but
distancing.
yes, we could definitely do distancing. We still follow the 6 feet kind of distance.
Mm-hmm.
All of the patients must wear masks as well as the
Mm-hmm.
therapists. We wear shields as well. But it's definitely much better than COVID because in COVID, fully suited up, I mean, everything. We're treating these patients, and our focus is sitting at edge of bed because the main thing we were preventing at that time was pneumonia.
Right.
Yeah, and another thing too. One thing that we had difficulty with, but we were very educated in our SNF, was in
Mm-hmm.
our precautions. We added that the RPE or the rate of perceived exertion must be low. It
Oh.
must be low to treat COVID patients because once you imagine if you try to stand a patient that has COVID,
Mm-hmm.
and they're using a lot of their energy to do that,
Mm-hmm.
they're just going to be weaker to fight the actual virus. That's really the priority.
All right.
Yeah. So again, to answer your question, it's a lot better. We treat the patients according to their designated zoning. Again, for green, we bring
Mm-hmm.
them down with mask,
Mm-hmm.
and we social distance. It's much better.
Mm-hmm. Wow. I wasn't when I was in the sniff. I wasn't able to because I left to move in a different um, work, but I didn't encounter any post-COVID or COVID patients that they transferred to SNF. So how was it treating COVID patients in the SNF? Are they already were they? I want to. I don't want to say. Are they COVID free by that time, or or do they still have an like active infection, or they can't leave? Can they leave the hospital being stable but still COVID positive? How did that go?
Yes. So what occurred at that time? So I was in red zone,
Uh huh.
which was the COVID section. The hospitals would transfer them to us after a couple of days, or I
Uh
think
huh.
10 days, or maybe 2 weeks. I'm not sure, where they're more stable.
Okay.
So at that time, I'm not too sure about that current
Uh huh.
COVID result once they came into our unit,
Mm-hmm.
but mentally we treated them as if they were COVID positive,
Okay.
which was the best way to treat them because we were extremely safe. We gowned up,
Mm-hmm.
we had everything on, we had goggles and a face shield. I mean, we definitely did the best because the main thing, Johan, at that time
Mm-hmm.
is, and this is, I have very, very good memories of this because there are certain situations where, of course, COVID attacks mainly the lungs and respiration and the
Mm-hmm.
pulmonary system.
Mm-hmm.
But once we were all working a team. Sometimes the PT, the OT, and speech, all of us were in one room just to sit a patient up, trying to feed them so they had energy to fight the actual virus, eat so they could actually take the medication.
Mm-hmm.
Um, and obviously, we would focus on breathing techniques
Mm-hmm.
in order to facilitate inspiration, expiration, as well as expelling fluids.
Mm-hmm.
So I was definitely in a stage where a lot of the treatments that we did prevented further pneumonia.
Mm-hmm.
And I think it really makes a difference in a lot of cases.
Mm-hmm. Wow. So with COVID, like starting with our coming over, and we don't know anything about it. So what are the things, or what made you more prepared to handle that in your facility?
Honestly,
Uh huh.
I don't think any of us were prepared
Mm-hmm.
for COVID, right? Obviously, I did my research. I always try to be prepared in what I do.
Mm-hmm.
But as a PT, I
Mm-hmm.
think in school, we're taught to be leaders.
Mm-hmm.
And I really wanted to volunteer for this position.
Mm-hmm.
So I did. And I think it's just because of my PT background where we're taught, again, we have to help facilitate the rehab team, at times lead or act when we're called upon.
Right.
Um, you definitely. And I think that I was definitely not prepared, but these patients really needed it,
Mm-hmm.
you know. And again, when we were in there, we're not exercising with them
Mm-hmm.
in this in kind of the realm of physical therapy. And what I mean by that is we're not marching, we're not doing single leg lunges, we're not doing
Mm-hmm.
modified squats because it's again geriatric patients. We
Mm-hmm.
are sitting at edge of bed, folk leaning forward, gait training to appropriate
Mm-hmm.
distances, doing a lot of functional
Mm-hmm.
things that um, that helps facilitate prevention of a lot of COVID signs and symptoms and progression.
Right.
Yeah, so that was a huge
Mm-hmm.
part, something huge that I learned that we weren't really trained for.
Mm-hmm.
Absolutely, but you have to be called in. You have to be
Wow.
called in.
So like everyone in the healthcare is like, all right, let's face this. Let's try our best.
Yeah, because we're in healthcare. It's
Mhm.
what we signed up for, and
Right.
I think honestly, at that time, I think the whole world.
Hmm.
I think some people in healthcare, that's when they kind of learned that, hey, maybe healthcare isn't for me.
Hmm.
But the people that were there, I think that's when it was cemented in them that,
Hmm.
hey, I'm supposed to be here. Because
Right.
that's how it was for me. That's how I
Hmm.
felt.
Yeah. When I was there, I was what at least made me more prepared, so to speak, is our DOR, our DON would, brief us frequently about what we're gonna be expecting, what's gonna be the process. Are we gonna be accepting, post COVID patients? What are we gonna do? Who's gonna treat them? So it kind of, gave me a little bit of comfort that, we are really like planning to what's coming. So I did volunteer as well to be one of the like,
Mm-hmm.
physical therapists in that area, but I wasn't able to reach that point to actually um, handle post COVID patient. Um, in sniff, we since you mentioned that we do encounter like a lot of people, we interact with nurses, with CNAs, with their relatives,
Mm-hmm.
and other staff there. Were you did you have an experience that you went beyond your, um, I mean, responsibilities or scope in your practice? Because when I was in sniff, I had an experience of I was the one to take the patient to the restroom, do their aftercare after they do number two, um because having them like leaving them with the CNAs, sometimes it would take longer, because the CNAs are busy and I had other patients. So sometimes I would be forced, but some, it's okay for me since that's also my time. I could practice, bathroom transfers and stuff like that. But in your experience, have you had that kind of, situations that you went beyond, or did something out of your scope
Mm-hmm.
just to help a
I,
patient?
absolutely. Your situation with bathroom hygiene, obviously, that's not PT.
Mm-hmm.
That's more CNA, and it can be OT in terms
Mm-hmm.
of ADL simulation.
Right.
But yes, that definitely has occurred. And first, again, we're not trained to do that, right?
Mm-hmm.
Specifically with me, I am not shy about it,
Mm-hmm.
but I just want to make sure I do it correctly because
Mm-hmm.
I don't want to hurt the patient. I don't want
Mm-hmm.
to, give them a rash or anything like that.
Mm-hmm.
Um, so what I learned was I really looked at two departments, which was again CNAs,
Mm-hmm.
which they taught me how
Mm-hmm.
to put on diapers, how to perform hygienic duties for patients, as well as the OTs.
Mm-hmm. Right.
The OTs also taught me that. You
Right.
know, um, that's I think that's one of the main things that were out of the scope of practice. I'm trying to remember them, but again, it's so team based. Where, like you said,
Mm-hmm.
sometimes for the benefit of the patient, you have to do maybe another duty
Mm-hmm.
that you didn't specifically train for, but you again you can learn. You
Right.
can learn, like again,
Mm-hmm.
hygiene, things like that.
Mm-hmm.
That's a great example.
Mm-hmm. Being in the sniff and having that experiences and stuff like that, what are the things you have learned that you carry and you want to pass along to other therapists and other colleagues who are thinking about going to the sniff practice or pondering upon if sniff is for me?
I would definitely say that sniff is definitely for a person that wants to demonstrate some form of leadership. Because the whole team, just by maybe somebody talking to you about a patient, they're already demonstrating leadership,
Mm-hmm.
right? Because they're going to the PT, going to the OT, going to the PTA, CODA, and figuring things out. But I think more or less, I think you could determine if you like sniff or if sniff is for you, if you like more subacute differential diagnosis, because that's what I love.
Mm-hmm.
I love, so I teach students, right? So I have two DPT students.
Mm-hmm.
A lot of the times I have PTA students as well, but in regard to DPT students, um, soon to be Dr. Kashishi and Dr. Um, Yagobi, these are amazing students. And I love just going to a patient's room and educating them that perhaps this patient has, liver cirrhosis. We see liver cirrhosis. And so we communicate. And since I'm the clinical instructor, I'd like them to demonstrate like asterexis, signs of liver flapping. I want them to observe ascites, the increased abdomen size.
Mhm.
A lot of these things are subacute, but you really won't focus on at outpatient. Because again, in outpatient or private practice, your focus is mainly treating the condition, right?
Right.
Treating CTS, treating rotator cuff. But at a SNF, there are so many issues with patients where they could come with a rotator cuff, but they have cancer of the stomach. They have frozen shoulder. But then you'll notice when you're testing them or when you're performing strengthening, you might notice that the patient's starting to demonstrate signs of maybe thoracic outlet syndrome. And that's when we do our special test. A lot of people think that in SNFs, we don't do special tests. No, we don't. We do. We absolutely do. We definitely don't do as much as home outpatient, but we definitely do. And we do it in, again, things that are more seen as subacute, TOS, problems with different nerves, CTS, carpal tunnel. So yes, if you like differential diagnosis, it's definitely for you, because I'll give you an example. So there's a patient that demonstrated a lot of thenar and hyperthenar atrophy of the hand, right? So what I did is, again, okay, so we noted that. I have the experience and the knowledge that I know it can definitely, it's pointing to a more neurologic condition. So I talked to the nurse, hey, I recommend that this patient be seen or have a consultation for the neurologist.
Mhm.
So I think, and it's one of APTA's goals actually, is for their PTs to definitely be in a bigger referral role,
Mhm.
right?
Right.
To refer because of primary practice.
Mhm.
So we definitely demonstrate that at our SNF.
Mhm. Nice. And while you were uh, sharing your experience, it I realized that there are like differences. With sniff, it's not like if you work in a sniff, it's the same for everyone. Because when I worked in a sniff, I didn't get that much of an ortho um, cases. It would be mostly, as I've mentioned before, in our conversation earlier. It's usually like deconditioning, some a lot of hip replacement, knee replacements. So there's not much of special tests that I did, or differential. But yes, I do agree that there are, sometimes you would catch things that are not in the referral, that this is something strange, so I should look into it. So I agree that you have to be really mindful, and knowing all of those, all of your differential diagnosis, and really looking into the whole patient, not just what that patient was referred to. That's nice. It's not just like it's not only in home health or in private practice that you do that, but also in a skilled nursing facility. Um,
Absolutely.
mhm,
Yeah, our SNF is totally unique. I think
mhm,
like sometimes we'll get cases where the patient had a fall and has 6 fractures on one side. And this is, I think again, another addition to one of the reasons why you should join it, if you think you should like a SNF,
uh-huh,
is when you like problem solving,
mm,
because with me, once I knew that this patient had so many fractures on the right side,
mhm,
my thinking was, how do I get this patient better? What's the weight bearing? How
mhm,
do I stand this patient up with the weight bearing? How do I go to point A to B, point A to
mhm,
C, and
mhm,
eventually point A to home safely, right?
mhm,
So, so yes, I think again, as we've mentioned before, every SNF's different, every home health, every hospital's different. I would recommend PTs that are watching this to definitely go to the
Mm-hmm.
focus on the population first.
Mm-hmm.
If you want to become a sports specialist, find the younger population, and then it's either university, it's professional team, as we might talk about later,
Uh-huh.
uh, and so forth and so on. But if you like the geriatric population, hospital, SNF, and then find the right one for you.
Mm-hmm.
Look into the cases there, look
Right.
into the team there,
Mm-hmm.
because our SNF, I've gone to different SNFs, and I always wanted to come back
Oh, okay.
because, yeah, because where I'm working, the the DON is highly skilled. It's
Mm-hmm.
highly skilled. Our DOR is highly skilled.
Mm-hmm.
Our team is highly skilled, and we just keep improving. We keep
Mm-hmm.
improving. If I have knowledge, I'll definitely share it. If somebody else has knowledge that I don't know,
Mm-hmm.
I would definitely learn it.
Right. Yeah, that's a good advice for those who are thinking about probably getting into the sniff practice. So I have three questions that that's not that I didn't give to you, surprise questions. So because I wanted to get your impromptu
Natural,
answer.
honest.
Yep,
Let's
honest
do it.
answers for this. All right. So this part I usually have last bites, but this time I'm gonna call it food for thought. Okay. So the first two is a fill in the blank question. All right. So
Okay,
first
I love
one
this. Okay, let me
is
focus. Let me
okay.
focus.
All
Okay, I
right.
love this.
So the first one is success is dot dot dot.
The words that come to me is success is what you want it to be,
Mm-hmm.
right? Because success could be just going to work and going back home. Other
Mm-hmm.
people, success is going to work, making a difference, going back home. You know, some people, success is just going to work,
Mm-hmm.
right? So, so to me, definitely, success is what you make it. And hopefully later, I'll go into some more tips that I definitely want to share
Mm-hmm. Right.
with the mentors.
Mm-hmm.
Absolutely.
Right.
But happiness or success is what you want it to be.
Perfect. Success is what you make it to be. All right. Second question, another fill in the blank um, item. So, in order to elevate our profession, we talked about this earlier. So, in order to elevate our profession and ourselves as a professional, we should dot dot dot.
Lift each other up. Okay. This is my whole focus. I would not be in the position I am, or I would not have the knowledge I am if it weren't for my professors, weren't for the DOR, DON lifting me up into and guiding me and mentoring me. I think I might share it now rather than
Sure.
later just because
Mm-hmm.
it fits in.
Right.
But what I suggest every PT to do, and this works with everybody, but find somebody that you'd like to emulate that is in a position where you want to be. Dr. Vitete is in my head pushing me, right? Always pushing me. And that's something that I want to have. He's excelling and I'm excelling as well. I want to be where he is, but then I don't want to stop. I don't want to stop. I just want to keep going. I know he's going to keep going,
Mm-hmm.
but he's lifting the physical therapy practice to where, because before people didn't really know about PT, right? Some other people thought that it wasn't as skilled as it is, right?
Mm-hmm.
But now more so, especially with the introduction of professional sports and a lot of people saying, hey, the secret weapon a lot of times is physical therapy, right? I know Kobe said that about Dr. Soto. Um, and again, just finding these people. So in regards to Dr. Soto, again, if I could share that
Yeah.
story.
Go on. Yeah.
Okay.
I'm excited to hear
So,
that too again.
okay. So I definitely want people to not be shy to look for mentors, and maybe I could help somebody that's watching this. I'll definitely try to leave some type of contact information towards the end, or maybe with you, Johan, that we could kind of figure things out. But there was a time I've been working at our SNF for 4 years. And I was thinking about 2 years ago, hey, I want to maybe become uh, a physical therapist, because no, a physical therapist professionalized in sports.
Mm-hmm.
No matter what I wanted, what field I want to be in,
Mm-hmm.
I always wanted to be one of the greatest at it. Okay,
Mm-hmm.
one of the best. That's what drives me. And when I thought my certified strength and conditioning specialist is more focused on professional sports, it actually clears me to work with professional sports. It's kind of a gold standard now.
Mm-hmm.
If you don't have the CSCS, you'll have a lot of difficulty working with sports.
Mm-hmm.
But at that time, I said, hey, I might want to become a specialist for sports. Who do I know, or I don't know personally, but who do I want to emulate?
Mm-hmm.
And the first person that came into mind was Dr. Soto. Okay. And for you viewers who don't know, Dr. Soto is Kobe Bryant's personal physical therapist. And she's also like the head of rehabilitation for the Lakers. Okay. She's extremely renowned. She is extremely respected. So I call her. And how do I call her? How do I know her? Right? I don't know her. Okay. So what I do is I find a way. I call the Lakers customer service. And what I do is, hey, I'm a physical therapist. Could you refer me to the rehab department? Which they do. It leads to Dr. Soto's voicemail. She's extremely busy. And I left my voicemail. I
Mm-hmm.
told her, please, I would, whatever it takes, I just want to learn from the best, which is you. I want to emulate you, because at that time I was thinking about going to sports.
Mm-hmm.
Um, please let me know if I could do anything. Again, I'll work at the SNF that I love, and then afterwards go to you, get 2 hours of sleep. It's okay. I just want to learn from the best. And then I didn't expect any call back, but when I was at my SNF, I got a call back, and she picks up. Hi, Michael. This is Dr. Soto. I'm fan shocked right now. I'm talking to Kobe Bryant's physical therapist, and mind you, Kobe Bryant, I think, is quoted saying that Dr. Soto is his secret weapon. I think.
Mm-hmm. Yeah.
I think we'll eventually understand the huge role that PT has in all departments, in all patient populations,
Mm-hmm.
especially with prevention. Without PTs, I think there would for sure be so many more injuries.
Mm-hmm.
But anyways, she guides me. Okay, Dr. Soto says, Michael, if you want to work in a professional sports, it's great that you have your CSCS, but you have to move forward. Go ahead, find a university or a school, find a university or college that would hire you to manage their sports team, and then we'll talk, right? And then we'll talk, and then we'll keep going on from there. But the fact that Dr. Soto returned my call is
Right.
amazing. And I called her again. Okay, I called her again. Maybe 6 months later, just kind of figuring things out. And then once I really thought about it, I kind of grown into myself
Mm-hmm.
in I've grown into myself at our SNF. I realized that professional sports might not be for me.
Mm-hmm.
Um, I love treating sports, but what I love more is identifying orthopedic conditions. I like identifying, hey, this patient might have TOS. Again, that's not an orthopedic condition, but again, maybe this patient has a dislocation,
Mm-hmm.
maybe this patient has a compression of like the L2 vertebrae because hip flexion is affected.
Mm-hmm.
But guys, please, if you learn or are inspired by anything in what Johan and I speak about during this conversation, is please find a mentor and don't be shy. Sometimes your mentors or who you want to be a mentor will be so respected that you're actually reaching out that they actually might teach you more.
Mm-hmm.
Like again, Dr. Soto, she did not have to call me. She did not have to call me back twice. She did not have to call me back twice. But the fact that we talk, I definitely wanted to level up my game and just continue to be better.
Right.
That
I,
is a good, it's a good story.
I like that story. I
Yeah.
like that story because it shows that, like, if you have a dream or a goal in mind and you don't know how to get there, try reaching out to people who are already there, and leave voicemail, email, whatever. And the worst thing that could happen is they don't return back, right? And if they reply, leave you a voicemail, I think that's something already. You gained a mentor, or at least an advice from them, right?
Yes,
Hmm.
yes, yes. Keep going, keep
Hmm.
pushing. Again, let these people know how much you want to learn from them, because at a time they needed help too.
Hmm.
I'm sure Dr. Soto, no matter how high she is, I'm sure somebody mentored her to be in her position.
Hmm.
Dr. Vitente, who is so high already, right?
Hmm.
Somebody helped him. Somebody helped him. So we just need to continue that process. And because they were helped, um, they are more prone to helping. Because again, if you see the list of all of the professors that helped me, and that's the only thing I wrote, that's why I take students. I take students in because I know the impact that a clinical instructor could make,
Hmm.
because they've all impacted me. Again, I would not be here without them. Um, I would not want to continue maybe being further specialized, keep going with my specialization if it wasn't for um, uh, Dr. Vitente, who keeps telling me, "Hey, Michael, you have potential. Just let's raise up the profession." And I think we could definitely do that collectively. We all must.
All right, great, great. There's a lot of story and advice for that question. So in
Yeah,
order
I'm
to, like,
sorry. I'm sorry.
no, it's good. It's good. A lot of people
Yeah.
would be inspired by that. Try to reach out to people that you wanna emulate and have as a role model. Look at their career, how they started, and where they are now. So great. So my third question for this segment is, what are the three ingredients that are essential and true, you find true in your life? It can be a value, a trait, a principle, a belief that you carry with you each and every day of your life. So three things that make up Michael.
Okay. So for me, I'll just say the first three things that come into mind. One is honesty. Uh, and what I mean by that is I'm honest to what I know,
Mhm.
but I'm also honest to what I don't know. And I try to pursue that. I definitely try to pursue that. Two, I'm very loyal. Okay. I'm very loyal to my team. I'm loyal to my mentors, including my DOR, um, the DON. I'm very loyal to her as well. Um, let's see the third thing. The third thing, team player. Yeah, for sure. For sure. I'm absolutely a team player. I think it's something that I value greatly. Sometimes in your again in that sub team, like I mentioned, I work with two great PTAs, which is Luis and Taylor. A lot of times they'll know things that about the patients that I don't know, right?
Mhm.
And it's that communication where I'll ask them, what is your professional opinion on it? I trust your professional judgment, and we move forward. So that would be my third one, is team a team player.
Team player. All right. So honesty, uh, loyalty, and being a team player. I like what
Mm,
you said about being honest with what you know and also with what you don't know. There's no shame, not about not lacking some things, uh, because you can find out what about the things that you don't know. You can research. There's shame if you don't if you stop learning, if you stop trying to be curious about things. So, like, all right. So thank you for our conversation this evening, with a lot of your advice and nuggets of wisdom and their experience in skilled nursing facility as a physical therapist. So, as a takeaway, what do you want our audience uh, to take away to take with them in their practice, in their life, and from this conversation, some
I
words of
was
wisdom.
I would definitely tell the people listening to follow your path that you know is right. Wishful thinking, I think a lot of the times with individuals, we know if we're on the right path or not.
Mhm.
And if we're saying we might know that we're on the wrong path, but we're saying, hey, this is going to lead somewhere. It's right, but we're lying to ourselves. I think honestly, find your right path, find the people who are in line with you, and speak to them and learn to them and help and and again find your mentors, and once they lead you forward into that line, make sure you look back and reach out to help that next person in line, and just continue that cycle, so we're continuously lifting each other up and not bringing each other down. We're all lifting each other up.
I love that. I love that. That's superb. All right. So again, thank you for your time, and thank you for sharing again your experience and your uh, uh, expertise with the sniff practice and all those experiences and inspiring stories, especially with reaching out with your Dr. Soto and all your other things that you said in the conversation. Again, thank you for your time, and thank you for being in the show.
Johan, thank you so much for inviting me as a guest speaker. Again, I am truly humbled and honored to be here. Again, I was very excited. Hopefully, again, we'll definitely communicate further. But thank you so much. You are doing an amazing thing. The PT world is proud of you. I'm sure. I'm
Well,
sure.
I'm not sure, but yeah, thank you. Thank you for the kind words.
Absolutely.